Okay, I guess we will go ahead and get started. Good afternoon. My name is Stephanie Williams, and I am the president of the Women's Political Collaborative. On behalf of the board and our members, I welcome you to this Lunch and Learn conversation on healthcare disparities. As president of the collaborative, I urge you all to consider becoming a member. We are built on the strength of our membership, and our membership allows us to continue to bring informative programs and events to the community. Joining is a simple process that takes less than 5 minutes and can be done online at www.wpctn.com. Before we get started today, I do want to take a moment to recognize and honor the life and legacy of School Board Chair Anna Shepard. Anna was a committed and faithful servant to our community who was loved and cherished by all of those who came in contact with her, and she will be missed. She leaves behind an incredible legacy and strong framework for Metro Nashville Public Schools and its students, and our thoughts and prayers are with the Shepard family during this time. I will now pass the program over to our moderator, Ms. Sally Smallwood, co-founder of the Coalition for a Strong Tennessee. Good afternoon, Sally.
Good afternoon. Thank you. We're excited to be here.
Well, thank you for being here and pulling together this incredible panel. I think we're all excited to hear from them. So without further ado, I'm going to turn off my video and mute my mic and turn it over to you.
Thank you. Thank you. We're excited to be here too. We're also very brave to follow Judge Calloway. Listened to her last week and it was like, she is really good, but we're good. Our game is on, so here we go. And just a few opening remarks. The Coalition for a Strong Tennessee mission is to support bipartisan solutions that use all federal dollars available under the Affordable Care Act for comprehensive health care coverage. And so your four panel experts today represent coalition organizations, and we're going to be focusing on health disparities in their areas of coverage. And by health disparities, we're referring to a higher burden of illness, injury, disability, or mortality experienced by one group relative to another. And the other definition I want to get out there is social determinants of health have everything to do with which side of the disparity equation a person ends up on. And when we're talking about social determinants of health, we're talking about where people live, learn, work, and play. And we're at a time when many of these are intersecting. In fact, I would say our social determinants of health are on steroids. So this is a very appropriate conversation to have right now. And so first I'd like to introduce Alyssa Lapolt. She is Director of Policy and Advocacy for NAMI, Tennessee. Donna DeStefano is Assistant Executive Director of the Tennessee Disability Coalition. Dr. Robin Mays is Program Director of UT General Dentistry Residency Program. She's also the Assistant Dental Director at Matthew Walker Comprehensive Health Center. And Emily Ogden is the Tennessee Government Relations Director for the American Cancer Society Cancer Action Network. So our first question, panelists, is what does lack of access look like for those you serve? And can you share a few statistics? Alisa, let's start with you, please.
Thank you. So for those of you who aren't familiar with NAMI Tennessee, I just want to take a second and explain. NAMI stands for the National Alliance on Mental Illness, and I work for the state office as the Policy and Advocacy Director, and NAMI provides education awareness for individuals and families affected by mental illness. So what lack of access looks like in our community is this. Imagine a 28-year-old man, a person of color, who is exhibiting signs of a mental health challenge, perhaps mood swings. Maybe one week he's suffering from extreme fatigue. The next week he's revved up because he hasn't yet been diagnosed with bipolar disorder. That's because his symptoms make him unable to secure and maintain a job that has health insurance. And we know by statistics that by age 14, the schools, healthcare providers have missed his symptoms and written it off as typical teenage behavior. We know by age 24 that they've also been written off maybe because he's not mature. and he's just going through a wild phase. Of all lifetime cases of mental illness, 50% of the symptoms, in 50% of the lifetime cases, symptoms start showing up by age 14. And in 75% of those cases of lifetime mental illness, symptoms show up by age 24. So because he doesn't have a job, because he doesn't have health insurance, he can't get his diagnosis. And that is what lack of access looks like for people in our community.
Thanks. Donna?
Thank you, and thank you for the invitation to be here. I'll do a brief thing on the Tennessee Disability Coalition. We're a cross-disability, cross-age organization that have approximately 40 members across the state that work together for what I tell my family on the elevator speech is good public policy and against bad public policy for people with disabilities. So I guess lack of access depends so much on, individual circumstances and what the disability is and those types of things, which I'll get into in a little bit. But one example would be a person who has a woman with mobility disabilities who goes to the doctor for a physical examination, and the examination table is too high. It doesn't adjust, so she's not able to get up on that. So she doesn't get a full exam, doesn't get a pap test. And this could result in, the lack of a diagnosis if there are any conditions that need to be treated. And ultimately, it could cost that person her life. Simple, accessible table. So that's just one of many examples. People with disabilities represent almost 19% of the United States population. It's a diverse group. It crosses race, age, income level, gender, ethnicity. The prevalence, however, of people with disabilities, people that report a disability, is higher for African Americans at almost 21% compared to just under 20% for non-Hispanic whites, 13% for Hispanics, and 12% for Asian Americans. So this interrelatedness, this what people call intersectionality of these social categories can be huge. And it's not simply additive, it's beyond that. So that people with disabilities are twice as likely to live in poverty. People with mobility disabilities, as we saw in my example, are more likely to not get full medical examinations, full healthcare examinations. People with multiple disabilities often have poor health due to the fact that they've got multiple disabilities and multiple healthcare issues. And in fact, I'll close with this. There was a recent study that came out at the end of May as we were in the midst of the pandemic that showed that people with developmental disabilities, and that would be like people with cerebral palsy, Down syndrome, people with intellectual disabilities, are significantly more likely to die from COVID if they get it than other people. And that's huge.
Robin, go ahead. We can't hear you.
Good afternoon, everyone. Again, my name is Dr. Robin Mays, and I serve as the Assistant Dental Director at Matthew Walker Comprehensive Health Center, and also as the Residency Program Director for the University of Tennessee Health Science Center General Dentistry Program. At Matthew Walker, we have a history of serving our uninsured, underinsured, vulnerable, and poor population for over 50 years now, with one of our main causes and purposes of increasing access to care to our vulnerable populations. And out of that same breath came the establishment of our residency program through a partnership with the University of Tennessee and St. Thomas Hospital to increase access to care to specifically Middle Tennessee natives. What does lack of access mean with specific regards to dentistry? What that means on any given day is an individual coming in primarily between the ages of 21 and 65, because Tennessee is one of 3 states that does not provide dental coverage for adults after the age of 21. And so as a federally funded health center, we are able to provide a sliding fee scale, which is income-based for our patients. And so despite the ability to pay for our patients, we are able to provide them with dental services that can prevent them from having to overpopulate emergency rooms, that can prevent them from having to miss work, from having to miss school, all of which help to contribute to successful and productive citizens in our community. Lack of access also means having patients who come in who have not seen a dentist since they were a child. Because of that, they haven't had a cleaning since they were a child, and they think that just simply brushing and flossing their teeth is enough to get by. And they now realize that they have gum disease, which has contributed to possible diabetes, to heart disease, as well as a myriad of other medical conditions. So it's a severe problem, but day by day, we are trying to make our way to helping increase that access to care.
Emily?
Hello, I'm Emily Ogden, and I am the Tennessee Government Relations Director for the American Cancer Society Cancer Action Network. And we are the public advocacy, public policy arm of the American Cancer Society. So we advocate for issues on the local, state, and federal level, dealing with prevention, dealing with a lot of insurance issues, pharmaceutical issues, and access is really, I've always said that access is kind of the name of the game when it comes to cancer care. What does access mean? So in a general sense, prior to the COVID-19 pandemic, which we know has changed a lot of things, 28 million people in the US lacked health insurance coverage. And this includes a disproportionate number of people of color. And while the federal health care law, known as the Affordable Care Act, has reduced the number of uninsured in communities of color, African Americans are still 1.5 times more likely to be uninsured compared to whites. Hispanic, Latinx, and uninsured rate is over 2.5 times higher than whites. And individuals in rural counties still lack insurance at higher rates than those living in urban areas. So, you know, when we think about access, you know, I always say one of the name of the games is if you can catch cancer early, then your chances of survival are a lot higher. But for example, for socioeconomic disparities and overall cancer mortality, it varies widely, but having insurance or not having insurance can really be a life-changing issue for someone. For example, colorectal screening rates are about 25% for people who are uninsured, but closer to 60% for people who are insured. Another thing that is a problem with access for cancer patients is it's not just that you have your health insurance card, it's, you know, do you have a clinic close by? Geography is a huge problem for a lot of our patients. Cancer patients that live in rural areas spend 66% more time traveling one way to see a cancer care provider. So lack of transportation, lack of childcare, all of these things play into what is lack of access that has a negative impact on someone's cancer care or cancer treatment.
Thank you. Thank you. So, Donna, what seems to be the most glaring disparities in your area?
I guess I would say that they're really related to the delays in diagnosis and then potential treatment. So, you know, lack of access, lack of physical access. Can people get into the building? Can they get around the building? I had a person call not too long ago that in order to get into the doctor's office, they had to go in through the service deliveries in back. And then get in through another office that was also in that complex. That's crazy. So as I talked before about inaccessible exam tables, weight scales that are inaccessible often put people, you know, again, that lack of access puts people much more at risk and causing more potential health conditions. The lack of effective communication is also an access point for folks with disabilities. People, for instance, that use an assistive listening or assistive device to be able to communicate. Some providers are not comfortable with that. Some people who are deaf use sign language. That is its own language, and they need an interpreter. And that the onus is on the healthcare provider to provide that. And if the healthcare provider doesn't know that and the patient doesn't know that, oftentimes there's just a total lack of communication that goes on during a healthcare visit. The other major thing in terms of glaring disparities, the quality of care. There are, there are prejudices, there are social assumptions about people with disabilities that they're dependent, they're needy, they have, all these things. And again, it depends on the disability. It depends whether it's multiple disabilities or not. But that's a very real factor for how people perceive other people with disabilities. And it impacts policies and procedures. And I'll just give you, we recently in this state, a number of disability advocates entered a complaint with the Office of Civil Rights, Health and Human Services, as the pandemic was gearing up, because we were finding hospital policies that were basically saying if a person has a disability, they don't need treatment, period. And so that's discriminatory. You actually have to take a look at the person and their needs and those types of things, not just outright dismiss people with disabilities. Connecticut, there were a number of states that filed these complaints. Connecticut just reached an agreement, and Tennessee's on the cusp of a settlement regarding that type of thing.
Thank you. Robin, what are the most glaring disparities in your field?
So speaking primarily from a clinical standpoint, some of the most glaring disparities involve just chronic tooth decay, as well as overall toothlessness. And that is not something that discriminates with age. We oftentimes relate toothlessness to mature adults. And depending on just personal circumstances and life occurrences of patients, we have patients who come in their 20s, their 30s, their 40s, who are missing numerous teeth and don't have an ability, A, to have it treated, but B, to have it replaced, because it's not enough to just get rid of the pain and to get rid of the teeth that are causing issues. It's also important to make sure we're replacing those teeth so that our patients can go back out and feel, confident with themselves and comfortable with themselves. Another issue is just overall lack of education as it relates to overall dental care. As a child, you may have had a dentist come into your school or into your daycare to talk about good oral hygiene and just a strong maintenance program as it relates to dental health. But as you get older, you stop having those PSAs, so to speak. And so a lot of times patients come in and they don't understand or realize all of the services that are available to them. And as a result, they make poor decisions and choices as it relates to their overall dental care.
Emily?
Okay. Yes. So for nearly 3 decades, the cancer death rate in the United States has steadily decreased, but not all individuals have equally benefited from the advances in cancer prevention, early detection, diagnostic testing, and treatment care. What we see is that racial ethnic groups, individuals of lower socioeconomic status, and other medically underserved individuals face a higher rate of cancer, later stage diagnoses, and higher rates of mortality for a number of cancers. For example, the breast cancer mortality rate for African American women is 39% higher than for white women. Due to years of segregated neighborhoods and unequal access to healthcare, clean water, and healthy foods, along with other systemic policies, this has created greater prevalence of risk factors for developing diseases like cancer in communities of color. And these are all areas that policymakers should be looking at when they are thinking about, how can we help the cancer burden for Tennesseans?
Elisa.
For us in the mental health community, the most glaring example of a disparity has to do with the availability of mental health services in communities. Here in Nashville, we've got far more resources than, say, in Greene County, Tennessee, where I'm from, where if you're suicidal, you've got to travel an hour and a half to go to an inpatient treatment facility in some cases. So people with low, like Emily said, people of low socioeconomic status are, they don't have access to the services that others do. And we know that people in that low socioeconomic status are 2 to 3 times more likely to have a mental health challenge than others. Part of that is because of the stress of finances, lack of jobs. And that's why the COVID-19 and this coronavirus situation is so concerning to us, is because we know we're gonna see an increase in mental health cases because of the pressures due to job loss, health concerns, and so forth. So in communities where there are no providers that will accept Medicaid, or there's just simply no treatment facilities available, that presents a huge disparity. Rural communities, and then also going back to the socioeconomic status, that presents a problem for individuals of color because, and this is according to the American Psychiatric Association, we know that 27% of African Americans live below the poverty level, but yet only about 10% of non-Hispanic whites do. So that's a huge disparity.
Thank you. Thank you. Now we're going to do something a little different. We're going to do a poll, and it should be coming up right now. And we'd like to know how many of you have ever experienced or personally observed the reality of a health disparity. And if you would go ahead and respond, we'd love to kind of touch base with you all. Meanwhile, we're going to go on and keep talking, and I'll come back to that as you complete the poll. Group, what are the long-term implications of the disparities that you've been describing? And some of you have already touched on that, but if there's anything else you can add, or if you haven't touched on it yet, let's start with Robin, please.
So as I've mentioned previously, and as hopefully most of you all are aware, with regards to dental health, we know that it affects the patient's overall health. And I think that's important to always keep in mind, is that dental health affects overall health and vice versa. We know that there's a link between physical health as it relates to diabetes, stroke, low birth weight for pregnant women and their deliveries, as well as mental health as it relates to depression and anxiety. A lot of times patients who are not happy about the way their smile looks, they do not smile, they do not go out in public, which leads to depression. When they do talk to individuals, there's a higher level of anxiety, and all that again links right back to their physical health. Also, patients who have poor oral health are more likely to miss work. Kids are more likely to miss school. And so it increases poor attendance and poor performance at work as well.
Thank you. Emily?
I already touched on just the lack of screenings for people of color and the implications of that. But the other thing I'd like to touch on is what we're seeing are disparities in clinical trials. There's a million clinical trials out there that are doing amazing research, but the participation of people of color in these trials is very small. And we can't get the best outcome for our new research, for new drugs, for new therapies, if the people that are participating in the clinical trials don't represent the total population. So that would be something I would bring up as well. We're never going to see the eradication of cancer or the cancer burden eased for everybody if the population of the country is not reflected in what we're doing with clinical trials, in what we're doing with screenings, and in what we're doing with treatment.
Thank you. Elisa?
So we know that in any given year, 1 in 5 individuals will encounter a mental health challenge. So that's 20% of the population. And unless they get a diagnosis and treatment, then the long-term implications include potential difficulties at work, difficulties keeping a job, difficulties with relationships, and in some cases, even incarceration. And here's why. Because a lot of times we see a person in a mental health crisis is treated differently. In other words, law enforcement will often come to a situation or be called to a scene not recognizing that a person is having a mental health crisis and is instead, committing some type of crime, disorderly conduct, and then they wind up in jail. And luckily at NAMI, we do partner with an organization called CIT, Crisis Intervention Teams, to do trainings of law enforcement officers to recognize those situations. So yeah, eventually a long-term implication of not getting treatment could be incarceration. And as we know, that's disproportionate to the African-American community. They're incarcerated at a higher rate than non-Hispanic whites.
Thank you. And Donna, long-term
Yeah,
implications.
sorry.
That's all right.
Yes, folks have said most of them that I would say, so I would concur with most of them. We do know good health is foundational to all of our lives, and people with disabilities tend to have more healthcare needs, putting them at risk, and then with lack of access, actually having them have additional kinds of problems with healthcare, becoming sicker, getting more adding up the diagnoses as you become sicker and your health conditions worsen. Your functioning's not as good as it was. You may lose your job. You may not be able to go to school. You oftentimes lose your social connections and, potentially die. That's ultimately the worst case scenario. I would like to, since I think I have a little bit more time, in terms of dental health, I'm finding Robin's discussion very interesting. Many years ago, when I taught in a residential school at the time, late 70s, with kids with multiple disabilities, deaf, blind, intellectual disabilities, psychotic disabilities. I learned through a social connection that there was a program for dental care that a hygienist would actually come into the facility where the kids were and check everybody. And it happened to be a friend of a friend, so she came in on a regular basis. The kids were able to be in a better place, to just be calmer, to be able to have somebody playing around in their mouth and looking at it, doing some things, and then referring off to the children's dentist that we would, as staff, would take them to. But that was huge. And that program, it was just accidental. I learned about it, and I often wonder how many good programs like that are out there that could help. So,
Thank you. Thank you. All right. We have the results of our poll so far. How many of you have experienced or personally observed the reality of a health disparity? And 81% of you said you have, and 19% of you said you haven't. And I think that's very telling. And it's a point we wanted to make as we continue this discussion. So our next question is related to all of this. Emily, what keeps you up at night?
Right now, the thing that keeps me up at night, lots of things keep me up at night. I have a 4-year-old, but the thing that really keeps me up at night is what we are seeing during this pandemic, that we as a nation have made the decision that a lot of people's health insurance is directly tied to their employment status. And as more and more Americans and Tennesseans are losing their jobs and being unemployed, this has a particularly negative effect, obviously, on someone that's in the middle of cancer treatment that now has lost access to their health insurance. And also just people are worried about being able to afford their health care. We had a national survey out in March that indicated 4 out of every 10 respondents that the COVID-19 was affecting their ability to afford cancer care. And nearly half of those earning $30,000 or less, they were worried about affording their care, and more than a third of those earning up to $60,000 are worried. This exacerbates the coverage gap, particularly for people of color, and it makes it more likely that they will fall into the coverage gap in states like Tennessee that have failed to expand Medicaid, which we'll talk about in a minute.
Yeah. Okay. Elisa?
Keeps me up at night. Unfortunately, this is an easy answer for me. What keeps me up at night is a young man, age 21, who grew up with a lot of childhood trauma, had so-called adverse childhood experiences, which we heard about last week from Judge Calloway. A young man who was turned away by a treatment center in Knoxville because he wasn't actively suicidal at that moment, although he had attempted suicide 2 weeks earlier. A young man who shortly after that obtained a gun and died by suicide. And that young man is my nephew, and is the reason why I have moved back to Tennessee, because I do not want any young person in this state to feel like they have no other options other than suicide. So what also keeps me up at night is the concern that so many more people are going to be affected by the mental health implications of the coronavirus. And there was a Washington Post article recently stating that now 1 in 3 people are experiencing a mental health challenge. And it's not just the individual, it's the family, it's the community. When a person has mental illness, it's a family disease. It affects coworkers, it affects neighbors. So that leads to a lot of sleepless nights for sure.
Yeah. Thank you. Thank you. Donna?
I guess in a pandemic world, I would, reiterate some of the things that the other folks have said too. We have family members of kids and young adults with disabilities that are now having to homeschool, do the schooling with, and work for us, and, address the needs of kids that have different kinds of disabilities that don't understand why they can't graduate from high school. In a non-pandemic world, I would say that the lack of knowledge about the Americans with Disabilities Act and the Rehabilitation Act and the protections, the civil rights protections that they offer people are huge. And that concerns me deeply, because it's not just people with disabilities, but it's everybody that needs to know, and healthcare providers need to know, what kinds of things they should do. Folks with disabilities need to know what they should expect in terms of equal treatment, full and equal access to healthcare. And so that's huge. So that's the non-pandemic awake.
Okay, thank you. And Robin?
Me, what keeps me up right now as it relates to the pandemic, and we all know that opioid addiction is a problem, not only just in Tennessee, but nationally. And as a dentist, we were asked to pretty much shut down for the past 2 months to preserve PPE for essential workers. But we were still open to see emergency patients, but that also meant that since we couldn't perform treatment on the spot, that we had to prescribe them pain medication. And typically we try not to prescribe opioids because we have been able to complete treatment, but because of the pandemic and the request for restrictions on care, we have found that we are prescribing more than normal. So I worry that the numbers are going to go up as a result of us delaying care. But also just in general, the fact that while Tennessee does not provide dental coverage under Medicaid, and we do have safety net clinics and health centers that are out there, patients still can't afford dental care. And so the numbers say that 70% of patients delay dental care because of cost. And just trying to figure out how we can fill that void. Of course, a state plan would help, but there's still a void there that we have to figure out.
Okay. Thank you. Thank you. And now our last few questions are going to be about addressing a solution. We had a model. So many of you mentioned access. We had a model to expand access. It was Governor Haslam's Ensure Tennessee. You know, and we've got different requests before legislators each year about that. How big of a difference would expansion under the Affordable Care Act for those in the gap at 100 to 138% of poverty make a difference in all the disparities that you've been describing? Let's start with Elisa.
Okay, great. So pre-pandemic, we knew that Ensure Tennessee would cover about 300,000 Tennesseans. So you take 20% of that population, and that would be the population that is experiencing a mental health challenge in the year. So ideally, a program like Medicaid expansion, Ensure Tennessee, would ensure more people and give them at least access to mental health treatment services. But here's the problem. Access is one thing. The availability of providers to treat them is another. So there need to be some incentives like loan forgiveness programs for psychiatrists, for mental health providers who are in school, you know, medically underserved areas, you know, programs for that. So access under a program like Ensure Tennessee is one thing, but again, having the provider pool is another.
Mm-hmm. Okay, thank you. Donna?
I think the biggest thing is people would not have to impoverish themselves to access some level of health care. And with that gives expanded access. People would have a doctor that reasonably potentially have access to accessible medical equipment and needed medications that they have, and transportation, which is hugely important, as we know, in a state that's doesn't have great transportation. So I think we would see all around just better health for folks.
Mm-hmm. Robin?
Well, of course, you know, pulling on my dental strings, I would hope that the expansion plan would include dental first and foremost. There have been talks about expanding care at least for pregnant women, as well as also including some level of preventative care for patients. So just making sure that dental and overall oral health stays in that conversation would be my first hope and goal. And then just, you know, minimizing emergency care that we see. For the most part, patients have to choose, are they going to pay their electric bill or are they going to go to the dentist? Most of the time, the dentist is not going to win. So hoping that we can win some more of those moral debates that occur in patients' minds would be my hope.
And Emily?
So one of the things we know is that a greater proportion of African Americans live in states that have not expanded like Tennessee. So the disparate impact of not expanding TennCare in Tennessee is greater for people of color. Obviously, for a cancer diagnosis can be one of the #1 causes for medical bankruptcy that people face. If more people had access to TennCare, obviously they would not feel the financial strains that their family might face. One of the things around cancer care with TennCare right now, they do cover breast and cervical screening and treatment for women, but we have an inside baseball saying, you know, that if a female ends up with breast or cervical cancer, they've won the cancer lottery because they can automatically qualify for TennCare. But, you know, how is that any different from a 25-year-old male with colon cancer or someone with pancreatic cancer? So the more people that have access to comprehensive care and the continuation of services and follow-up care and treatment that Medicaid provide would have a huge impact on cancer treatments for Tennesseans.
And the governor's original budget this year did have a couple of things in it, like postpartum care for women for up to 1 year, because they showed that 51 women had died in the first year after birth, but that's been cut. And so there were some pieces and parts of coverage, but they're gone now.
Yeah, and dental services.
Yep, it was in there too, and it's gone.
Yeah.
It's gone. So and if anyone has any questions, please put them in the chat area because we will open up for questions. after this, but this August, we're going to celebrate 100 years of women's right to vote. We're the state that made it happen. Channeling the 1920s and the suffragettes' motto of deeds, not words. How do you suggest we raise our voice? Donna?
The American Association of People with Disabilities has had a campaign for quite a few years called Rev Up, which is register, educate, vote, and use your power. And their goal is to increase the political participation of people with disabilities. There was a study done regarding the 2012 election that basically said if people with disabilities voted at the same rate of people in their same demographic group, there would have been 3 million more people who would have voted, which is huge. So they are really encouraging at all levels, local, state, political, to get involved, involved in the campaigns of your choice. It's a nonpartisan effort. Really get out there and talk about disability-related issues. That's going to make a difference, we know, in terms of public policy. Justin Dart, who was the father of the Americans with Disabilities in some ways, said, vote as if your life depended on it, because it does, especially for people with disabilities. And on June 22nd and 23rd, there's going to be a disability and election virtual summit, nonpartisan, called Power the Disability Vote. And that's a huge effort to get mobilization and movement out there.
Great, thank you. Robin?
So within the state of Tennessee, there is a group called the Tennessee Alliance of Oral Health Advocates. There are branches in both Middle Tennessee, West Tennessee, and East Tennessee that predominantly are made up of oral health professionals, deans of dental schools, and whatnot, that work on rallying partnerships within the community to help with dental care, oral health advocacy. We meet with politicians, we meet with just neighbors and friends to help push the cause for dental care in Tennessee. So my hope would be that not only do those groups continue, but that we're able to work with our medical providers as well as our other friends to push the objectives of dental care within the state. So just having other allies within the state to help push our initiatives.
Thanks. Emily?
I would be remiss if I didn't say we would encourage you, if you are interested in making cancer an election issue and making cancer a policy issue for our elected officials, you can join ACS CAN at www.fightcancer.org. And we're happy, we do a lot of easy things. You can easily email your legislator. You can, with kind of just a touch of a button, you know, we can recruit you to do letters to the editor, a lot of things back in your local hometowns. We'll let you know when there's going to be, right now there's been some virtual town halls that legislators have done. If elected officials don't hear about what their constituents care about, they are not going to take action on those issues. So it is imperative that elected officials hear from their constituents. It doesn't really help as much if someone from Memphis is hearing someone from Bristol. They want to know that you can either vote for them or not vote for them, because at the end of the day, that's really powerful. They don't get to come back to Nashville if nobody votes for them, and they like to come to Nashville. So definitely get involved, get to know who your elected officials are, reach out to them, let them know that these are issues that are important to you, to your family, and to their communities.
Okay. And Elisa?
So I think we can all agree that mental health is going to continue to be a issue in the forefront of our communities. And at NAMI, advocacy is one of the pillars of the organization. So I teach people how to take their story about mental illness and tell it to policymakers. We have to overcome the stigma and the shame about mental illness. I personally was diagnosed with anxiety and depression after my dad died and then after my divorce. So I'm open about that. It's also really important that our affiliates across the state, we have about 20 local chapters, which we call affiliates. It's important that they talk to their community, the legislators back at home, the House members, the Senate members, that's how we raise our story, is by raise our voice, is by telling our stories of mental illness so that we can influence lawmakers to make the right choices when it comes to policies and funding around mental health.
Thanks. And I would just add, all are welcome to join the Coalition for a Strong Tennessee, which is the bigger picture of coverage for everybody in the state. You know, we're one of a handful of states that haven't expanded fully under the Affordable Care Act. And that's something that all of us are feeling the impact for. And if you go to bringourtaxeshome.org, you can sign up your organization to be a member. You can sign up individually, and we periodically do campaigns, because to just build on what everybody else has said, is the more that legislators hear about this and understand this is not going away, and understand how it would have made us better prepared for COVID. It would have addressed a lot of these health disparities that are part of the protests now. It just affects so many things. We do have a question, and panelists, I'll just let you raise your hand if you have an answer for this. It says, with defunding police departments, do any of you look forward to increased funding for services you provide? Or do you think that's going to happen in Music City? Is that anything anybody, I mean, I don't think we've seen any budgets, have we? I don't know about that. And we have, we had a question too about the postpartum care, and I think we already answered that has been removed from the budget and it's no longer in there. There was another kind of piece that was the Katie Beckett. Donna, is that still in the budget?
Yes, miracle of miracles. I mean, I think a lot of folks at the legislature put their heart and soul into it, and that's been protected. The state's still waiting to hear from the federal government whether they can move ahead. They submitted something through TennCare, but the two departments, TennCare and the Department of Intellectual and Developmental Disabilities, are moving ahead as if they have permission, and the start date will be July 1st. They're taking
Can you
just
tell us what that does?
Basically what that would do, it would give access to the Medicaid program for families whose incomes have been too high for them to qualify in the past. So it would take that piece away. There'd be, you know, depending upon income levels that people have, they'd have to pay something, but they wouldn't be outright denied access to the care for their kids that are in many cases have significant multiple disabilities. And the families spent quite a bit of time down the state legislature last year, the last couple of years, but especially last year, you know, with their children, suctioning their children in front of legislative committees. It made a huge impact. The commitment was there, and that remains, which is phenomenal in this day and age.
Thank you. All right. Well, if anybody else has any questions, if not, we will wrap this up. And I just want to say thank you very much. But, oh, sorry, I got a message, but it's not a question. It's an instruction. Okay. I just want to say thank you very much for joining us today. I hope that we were able to share some of the situations fellow Tennesseans are experiencing, what they're up against, how important it is to bring, frankly, all of our taxes home that are sitting there in the Affordable Care Act for our care. And that's $1.4 billion a year, which I think would make a huge difference. I just saw too, I read somewhere where our budget's off by 1.5 billion. So I thought, I mean, this is a great way to recover from everything. So I hope you'll join us in asking the governor to come up with a recovery plan and do just that. Next week, you're going to have a presentation on how elected women operate in different countries. I think there's going to be a sister city in Berkeley, Allen, and all sorts of good information. So With no further questions, thank you all very much. We appreciate this opportunity to share with you.
Thank you.
Thank you.
Bye.